Line number one, say good morning to our friend, child clinical psychologist. That's Janine Hubbard on line number one. Good morning, Dr. Hubbard. You're on the air.
Good morning, Patty.
Welcome to the program.
Well, and a happy Monday to you.
Happy Monday to you, too. Although up a little bit too late watching the Super Bowl, even though it was a great game, but a bit bleary-eyed. But let's get going. So, if the federal government in April of 2020 thought it was important to put an online and via phone service called Wellness Together and PocketWell, and some 4 million Canadians have used it. It was 24/7. It was free. I've given out the number to Wellness Together countless times on this program, and lo and behold, somebody up along has decided that it's no longer required, which I don't know how they make that calculation, this cost of living issue, and we're just post-pandemic or wherever we are, but all of a sudden it's gone away. When you heard the news, what did you think?
Well, certainly I know that we have a number of people who have found it an incredibly useful resource. So was really concerned in terms of, I guess, like many of the resources that were put in place during the pandemic, they were kind of designed as a stopgap emergency measure, which is fine. But if you're going to then remove it, what is replacing it? What is going to continue to meet those needs? Because the needs today are probably looking a little different than they were right back in those early days when, quite frankly, most of the mental health clinicians hadn't figured out how to do virtual services. In fact, a lot of them were being deployed to other areas, so not able to provide those services. A lot of people weren't working, so they didn't have access to things through work. So a lot of that situation has changed. But at the same time, we also know we have a huge gap in services. So I guess for me, I'd look at the Wellness Together and wonder, okay, what were the parts of that service that people were continuing to find useful? And what are we doing about replacing them in a different format? If indeed this format, was maybe more suitable to COVID-related concerns.
Possibly so. And I know you aren't necessarily going to get to speak with the same person, but in your own back of people's minds, continuity of care can indeed include whoever you speak with at Wellness Together. So does that make sense when I make the reference to continuum of care? Because I do think that becomes part of people's own resources. They've heard the number from me, or I've given those people the number. They think it's been helpful, and so consequently, even shifting gears to go to another service outlet or another platform might not feel the same. And how you feel about the treatment you're getting goes a long way to your managing your symptoms and or improving, or whatever the right phrase is.
Oh, no question. And I think there's three things. One, I think the introduction of the 988 suicide helpline is perhaps designed to take up some of the percentage of calls that Wellness Together was receiving. Now, obviously, that's not going to fit all of the needs that are there. The second thing, and we keep coming across this, is healthcare funding and programming comes from the provinces, not the federal government. The funding comes from feds, but it's supposed to be delivered provincially. So this is where we keep running into some of these difficulties when they launch a federal program. And it kind of gets the hot potato back and forth in terms of some of that funding. And bigger picture, short-term things are super helpful, no question. Emergency lines, warm lines, crisis lines, you name it. But as we've heard repeatedly, ideally, continuity of care from the same licensed, registered mental health professional to provide, whether it's single session service or whether it's long-term service, is really ultimately the goal that we're looking for here in the province.
To me, it's just a misread of the tea leaves, because if anything in this country, whether it be federal or provincial responsibility, expanding access to mental health care seems to be the appropriate path forward. Anything that's taken out of the system at this moment in time seems to fly in the face of the numbers that we used. When I first started this job, it was 1 in 5 Canadians with a mental health concern. Now it's 1 in 4. So it just seems wrong-headed to me.
Oh, I agree completely. And I think what would be really helpful for anybody who has been using Wellness Together and finding it useful is what aspects of it are useful and are gaps that aren't currently being provided by our provincial services. And then send that feedback to your politicians. Send that feedback to the Minister of Health. Because if there's a gap or a particular service that isn't being offered. Because again, remembering that it was often single session, crisis-oriented work, if we don't have that to substitute, then that's a really important issue that needs to be addressed. If it's more about the resources and some of the apps that were on there, that's important to know. So really understanding what specific aspects of the Wellness Together program people are finding essential.
It'd be interesting to hear from folks who have indeed used the service to give us that type of feedback. But, again, so you're taking something away. You and I have had many conversations about the concerns that psychologists would have in this province and the concerns that psychologists would have across the country. We know about wait times to see a psychiatrist. Yep. So when you add it all up, I'm just not so sure that people at Health Canada and or the federal government and or even the provincial government have understood the magnitude of the issue.
And I think unless you've been there, unless you've been watching either yourself or a loved one struggle and come up against barrier after barrier after barrier, I'm not sure you're going to get it. We have some who do, and then it's a question of, but how and in what ways. I think there is certainly more of a desire or willpower in government than we've ever seen, but it's a question of how are we going to make this happen?
How are we going to make it happen? $1 million question regardless of what we're talking about. Anything else you'd like to offer this morning while we have you, Janine?
Well, I was going to say the good news is great relief for a whole lot of public sector psychologists and their clientele. With the AHP agreement, that means there's going to be a whole lot less uncertainty and stress and less disruption, and we won't have to experience a disruption in services for those clients who do see public sector psychologists and social workers and counselors. So I'm very relieved on that piece of information that I think is going to be really helpful. And February is Psychology Month, so happy Psychology Month.
And the very same to you. Always appreciate your time, Dr. Hubbard. Thanks for doing it.
Thanks, Patty.
Take good care.
Bye.
Bye-bye.